I'm Wayne Shreffler. I'm the director of the Food Allergy Center at Mass General Hospital and Mass General Hospital for Children. And I want to talk to you a little bit about our program and in particular the role of food challenges, sort of the rationale behind them. Very briefly, kind of a little information about our experience here at Mass General. So food challenges have been recognized for a long time as being the gold standard for diagnosis, and really because of that, an incredibly important aspect of managing the care of children and adults with food allergies. That's really reflective of the fact that there's a lot of overdiagnosis of food allergy. The tests that we have commonly available, both skin testing and blood testing, is very sensitive on the one hand, but it's not always very specific. And so as many as 30% of people, perhaps higher, who think they have food allergies or have been told by a physician they have food allergies on the basis of a test, may not in fact have a reaction when they have that food. That might be because they've outgrown the food allergy in the intervening years, or it may be because they were simply diagnosed on the basis of a test only, and it's just falsely positive. So food challenges have been recognized as being very important by the NIH, and this is underscored in the literature. But there are a lot of obstacles that prevent physicians, particularly allergists in private practice, from offering food challenges in sufficient numbers. They are very time intensive. It requires usually a nurse who's one-to-one with the patient, or at most one-to-two, a physician that's closely supervising the challenge throughout. And they're therefore expensive. They sort of tie up a whole room. They don't reimburse very well. And lastly, there's some risk involved. And not everyone is going to be comfortable doing that in a private office. So from the beginning, when I came here in the fall of 2009 and started clinical services in the spring of 2010, we've put a lot of effort into this aspect of our program and being able to offer food challenges regularly. We do 3 or 4, sometimes 5 per week, and that we do them well. So we've now conducted over a couple of hundred food challenges in that time span between the providers among us. So far we've found about 65 to 70% of our patients pass those challenges. About half of them come in with a history of reacting to the food and may have outgrown it, and the other half come in with no history of known ingestion and just positive tests. We're comfortable with that frequency of passing, around 70%, as I said. We think that reflects well that we're being aggressive enough to try to get foods back into the diets of children or people who can tolerate them, but not overly aggressive, so that we're exposing people unnecessarily to the risk associated or just wasting everyone's time. About 5% of reactions are treated with epinephrine because there's some lower respiratory involvement. In both our own experience and in the published literature, there's been no bad outcomes associated with doing food challenges, and we feel comfortable with that 5% number being well in line with other people's experience, both published and anecdotal. There are a number of things that we do to minimize the risk associated with food challenges. Probably the most important is that the food itself is given in a graded fashion. So we start with 1% of the total dose and then progress from there on up. And that we really place the emphasis for these clinically indicated challenges on safety. And that is to say that we're not really looking to push patients to have severe reactions. We would rather stop a test at the early signs and symptoms that we think are indicative of an allergic reaction, even to some extent perhaps at the sacrifice of getting falsely concluding that someone is allergic if they have mild symptoms or purely subjective symptoms, that the emphasis really is on safety. These are open challenges. Both the patient and we know what's being eaten. These are not research-based blind challenges. So they're really just for the purpose of getting the food back into the diet. And for that reason, really, the thing that we ask of you, of patients, is that it be a food that you think your child or that you are really interested in adding back, and that you intend to eat that food. The few cases that have been reported of subsequent reactions following a past challenge have really all been people who didn't actually add the food back and then some year or two later have an exposure that's associated with a reaction. So we really want to reserve these food challenges for people who intend to add that food back to the diet actively. We choose the dose for food challenges really based on the importance of being able to confidently tell people that after passing a challenge like this that they're going to be able to eat the food as part of their regular diet and not experience any problem. So really the busy part of that challenge happens during that first day, but then we also formalize the introduction over the next couple of days and want to hear back from patients if they do have any reactions. We think of the food challenges really, along with everything we do at the Food Allergy Center, as reflective of our effort to really put together a multidisciplinary approach to the care of our patients, and that includes, may include gastroenterology for patients who have signs or symptoms that we think may be related to chronic GI inflammation that's due to food allergies. Clinical psychology for patients who have anxiety or other comorbidities related to their food allergies. Nutrition for patients who have challenges putting together a safe and nutritious diet, especially if they have multiple food allergies, and other other specialties as well.